Can you have two health insurances? Well, stay tuned because I'm going to answer that question and so much more and explains exactly how it works, okay? And so if you are new to me, to the channel, or to any of my content in social media land, my name is Katrice-The, and I am a licensed health and life insurance broker and the principal agent of the K. Daniels Insurance Agency. And I help African Americans to navigate their health insurance options and to enroll into affordable, comprehensive coverage based on their budget. Okay. I'm also the founder of Insure Black America, which is my community initiative, and that is to close the coverage gap in insurance for African Americans. All right, so let's get into it. Can you have two health insurances? Well, the short answer to that question is yes. Yes, you can have two health insurances, okay? And so according to data from the U.S. Census Bureau, okay, in 2021, approximately 43.1 million people, or 13.1%, were covered by more than one type of health insurance, okay? And so now let's go into why you would want to have more than one health insurance plan, okay? An obvious reason is because you want to reduce your out-of-pocket costs, okay? Because if you have two health insurances, the more will be covered by the insurance companies and less will have to come out of your pocket, okay? And so, but here are a few scenarios in which you may be covered by multiple health insurance plans. Now, this is not a comprehensive list. You would just have to take a look at your situation and see if having more than two health insurances would be beneficial for you and your situation, okay? And so you might want to supplement your private health insurance plan with a government program such as Medicare or Medicaid. A married person may have health insurance through their employer and be listed as a dependent under their spouse or partner's health insurance. A person under the age of 26 may have their own health insurance plan and remain a dependent on their parents' plan. A child of divorced parents may be listed as a dependent on both of their parents' health insurance policies, okay? Now, let's talk about how multiple health insurance policies work together, okay? So when you have two health insurance policies, it doesn't mean you'll be covered twice by both plans. It just means that both plans may cover some of the expenses, but that the combined benefits won't surpass the total cost of your visit, okay? So let me break that down. So that means that if you owe $50, okay, you go to the doctor and you owe $50, right? And one insurance may pay $20 and the other one may pay, say, $25, okay? That is what, $45. So there's a balance left, and your copay may have been $5, okay? And so that just means that both plans contributed to the paying of that, and so you only had to pay $5, which was your copay, okay? And so it can't go, but the plan can't cover more than the $50. So for another example, if it's $50, then one pays $25, one pays $25. There's nothing left for you to pay, but it won't go over that. So you can't have like one plan pay $25 and one plan pay $30. That would be more than your cover, which means you would get a refund. So there's no way that you would be able to get a refund by having two insurance policies, okay? It would cover your expenses up to 100%, and then that's it, okay? I hope that made sense because I kind of gave multiple examples, but I just wanted you to kind of see how it works, okay? Now, the reason it works like that is because of a process called coordination of benefits, okay? And so that means that one plan will be designated as your primary payer. Okay, that's your primary insurance. And then the second plan would be your secondary insurance. Okay, and so your primary plan processes the insurance claim first and covers the bill up to its coverage limits. Okay, and if your primary insurance is unable to cover the entire claim, that's when the secondary insurance may cover all or a portion of the remaining costs. Okay, so they will bill your secondary insurance and to get the balance covered, to see if they will cover the balance or how much of the balance will be covered. Okay, and now you still may be responsible for your cost sharing, which would be like your copays and your co-insurance. So if you have copays on both insurances, then you are going to be responsible for those copays. Okay, or if, say, that service is subject to co-insurance, then, which means it would be subject to the deductible, then you will have to, if you haven't met your deductible, you still have to meet the deductible. Okay, so the same rules that apply to your primary insurance as far as, you know, your cost sharing is the same rules that apply to the secondary as well. Okay, all right. Now, you don't get to choose which plan is your primary and which is your secondary. Okay, the coordination of benefits sets the rules based on the situation to help to dictate the order of coverage for each insurance plan. Okay, and so now the rules will vary by state and insurance provider, but I'm going to give you some scenarios where it usually works out this way. And it'll help you to determine your primary and secondary insurance. Okay, so the first scenario is you have your own employer-sponsored health insurance, and you're a dependent on your spouse or partner's plan. Okay, and so your insurance would be first. Okay, that would be your primary insurance, and then the secondary would be your spouse's. Okay, employer-sponsored plan. Okay, and this is for employer-sponsored plans. This is not talking about marketplace. Okay, because the rules for marketplace are different. Okay, now, and the flip side, your spouse's insurance would be their primary, and your plan would be their secondary. Okay. Okay, next situation, you're covered under Medicaid and have employer-sponsored health insurance. Okay, your employer-sponsored plan would be your primary, and then Medicaid would be your secondary. Okay, now you're covered under Medicare and you have employer-sponsored health insurance. Okay, your employer, if the company employs more than 20 people, then your employer-sponsored coverage would be primary. Okay. Now, if your company has fewer than 20 employees, then Medicare would be primary. Okay. And so if the employer is primary, that means Medicare is secondary. And if Medicare is primary, then that means the employer is secondary. Okay. Now, a caveat to that, most people that I have seen who do this, who have Medicare and employer-sponsored coverage, I have only seen them be on Medicare A and B, and then they have a Part D, and then they use their employer-sponsored coverage to cover those out-of-pockets, because Medicare is a fee-for-service. Okay, so depending on what the service is, then you're going to pay 20% of those costs. Okay, that's the co-insurance. It's 20%, and so But that 20% can be kind of high depending upon what the service is. Okay, and so I've seen them use their employer-sponsored coverage to cover that. Okay, to cover that cost. Okay. So that's that. Now, if you have a Medicare Advantage plan, okay, you can still do it. You can still use it, and it might even be cheaper because the Medicare Advantage plans, they're designed like employer-sponsored plans, and so they have an out-of-pocket limit and everything, and so those may even work better together than original Medicare, because original Medicare, there is no out-of-pocket limit. It's fee-for-service. Okay. If that didn't make sense for you, ask questions in the comments, and I'll be more than happy to elaborate in the comments. Okay. All right. You are under 26 and have student or employer health coverage, and you're a dependent on your parents' plan. Okay. And so your employer plan or your student plan, if you're in college, then that would come first. Okay. And then your parents' plan would be the secondary. Now, your children are covered under your health plan and your spouse's or partner's health plan. Okay. Now, to figure out the primary and secondary in this situation, whichever parent has the earliest birthday in the calendar year, their insurance would be primary, and then the parent with the later birthday would be the secondary. It would be the secondary payer. Okay. And then the last one is you're separated or divorced, and your children are covered under both your plan and your former spouse's plan or partner's plan. Okay. So in this situation, whichever parent has custody of the child, okay, then that would be the primary insurance. Okay. If the custody is joint, then you follow the birthday rule. Okay. Which is the earliest birthday in the calendar year would be primary, and then the later would be secondary. Okay. Now, the secondary would be the new legal spouse of the parent with custody or the parent without custody of the child. Okay. All right. So some pros and cons of having two health insurance plans. Okay. The benefits to having two is that a secondary health insurance plan will be able to cover expenses that your primary plan doesn't. Okay. So that's saving you money, right? Your overall out-of-pocket cost would be reduced if the plans complement each other to help limit your individual responsibilities. Okay. And you may feel a greater sense of security if you were to suddenly become unemployed and lose one insurance plan. Okay. You know, it's kind of like having a fallback, right? At least you'll still have insurance if you lose one. Okay. So some drawbacks to that would be that you have two separate premium and deductible responsibilities, which can add up over time and outweigh the benefits of having multiple insurance plans. So you really will have to just sit down and look at, you know, the cost of your monthly premium. How much would it be for the year? Then look at, you know, your deductible and your out-of-pocket costs for the year with both plans, and see how that would, you know, would the benefit of having two, you know, would it be greater than those costs. Okay. Now, and I was saying this earlier, even with two plans, your expenses may not be entirely covered, since the combined coverage can't exceed 100% of your health costs. So it really just depends on how much how much the plan is paying per service per plan, to see, if that combined would it cover it, okay? And it really just depends. And another factor that goes into that is, where do you go to have treatment, okay? You may want to call around and see, get some quotes for what they would charge you, and then you can go from there, okay? It does take a little bit of work, but it's really worth it. When it comes to your health care and your costs, it's really worth it to find, and also just to get a feel of the doctor's office, right? And see how they operate, okay? Now, the coordination of benefit process can make processing claims more complicated and time consuming. That is a truth. That's not true, but with the technology and everything that we have going on now, claims are done electronically, and so it's seamless. So it really it doesn't make it. It does make it a little more complicated because you do have to work with two separate insurance companies, but you're typing it in, so it's not that time consuming. Okay, and you're not the one that's going to be actually doing the billing. It's your insurance company. So it's the billing office of the provider where you got the service, and so that's not really a drawback for you. That's more for the provider. Okay. All right, and so if you have employer-sponsored coverage, and you are wanting to get more information about having more than one insurance plan, you can consult with your human resources. And then if you are ready to look into getting, another plan or something like that, or some type of supplemental plan, you can always book an appointment with me. We can go through your needs. We can assess your situation and see even if it would be beneficial for you to have a secondary insurance, okay? And so you can go to my link tree. You can book an appointment with me there, and also while you're there, grab my free checklist before you buy. And it's a checklist of things that you need to hone in on and focus in on when you are looking to buy health insurance, okay? All right, and so that is what I have for this video. Let me know in the comments, do you have two health insurances? And if so, what has been your experience with having two health insurances, okay? And so I hope you found value in this video. If you did, please do share it out so someone else may find value as well. And if you are looking for health insurance, you can book an appointment with me. You can go to my link tree. It's on the home page, but it's also in the description of this video, okay? And so have an amazing rest of your day, and until the next video, remember that together we can close the coverage gap for African Americans in insurance. Have a good one.